Ontario means business when it says stay home. Those who don't comply with the parameters set out by the government's emergency orders now risk huge fines and even jail time. That would have been unthinkable just a matter of weeks ago. With us now to consider how far government should be allowed to infringe on civil liberties in the name of public safety during this COVID crisis, we welcome, in Thunder Bay, Ontario, Ryan Alford, Associate Professor at Lakehead University's Boer-Alaskan Faculty of Law and the author of the forthcoming 7 Absolute Rights, which will be published next month. In the nation's capital, Colleen Flood, University Research Chair and Director of the University of Ottawa Centre for Health Law Policy and Ethics. And in the provincial capital, Dr. Micah Warner, Head of the Intensive Care Unit at the Michael Garron Hospital in Toronto. And we are delighted to welcome all three of you to TVO tonight for a discussion I frankly have not heard much of elsewhere, so I'm glad to have you three aboard so that we can get into it here. Michael, let me put you to work first. How adequate do you think are the measures put in place by different levels of government in proportion to the pandemic that you are dealing with on the front lines?
So I'm encouraged by the steps that have been taken recently, but I think that more significant steps should have been taken weeks ago. We on the front line saw this coming, and physical distancing, which is the term that's being used today, is the most effective tool the public has to mitigate the risk to themselves and also to the healthcare system of potential collapse. So I'm encouraged by what's been going on in government lately, but the measures need to be consistent across all jurisdictions and likely more stringent. I'm not going to talk about enforcement, that's not my end of things, but I think that more needs to be done still.
More stringent equals what?
We can't have any wiggle room. There can't be room for interpretation. There can't be different rules across different jurisdictions in Canada. A group of less than 50 was too many, now it's 5. The right number is 1. And I think that people need to understand that clearly from policymakers. Obviously, we have to make sure that society continues and that essential services are provided, but we can't leave any room for interpretation among the public.
If the right number is 1, let me just make sure everybody understands what you're saying. So if you and a kid or if you and a partner want to go out for a walk, you've got to be 6 feet apart. Doesn't matter. No more of this walking hand in hand down the street. Is that what you're saying?
That's not what I'm saying. So just to be clear, if you live in the same house and you've been following the rules, then assuming no one is sick in your house, then as long as you stay within that group of 5 people, I have 5 people in my family, then you can stay, closer than 6 feet within that group. But you can't commingle with other people who are also following the same rules. I think, that is one example where people are looking for a gray area. If I self-isolate and my friends self-isolate with their kids, then can't we just get together? And that's not the right way to interpret the rules. You can stay within your household, but you can't go beyond that to commingle with other people.
Okay, understood. Thank you for clarifying that. Colleen, your presence here in this discussion is really, it's unbelievably timely because you teach a course called Law of Modern Day Plagues, which seems eerily timely right now. How does this pandemic compare to, for example, past outbreaks that you are teaching your students about?
Yeah, I guess I'm going to be pretty popular next year. Well, I mean, in the course we start out with actually looking at the plague itself, and then coming forward into time into the Spanish flu, and more recent times with SARS and H1N1, Ebola, HIV and AIDS. So I think from the perspective of more modern day analysis, this is certainly an unprecedented moment, an unprecedented contagion, particularly given how quickly it spreads. And I think, that a bunch of things come into play here. At the time of the plague, it took basically years for it to move around the world because of the way that we traveled at that time. Now today, someone hops on a plane from Wuhan and or wherever in Italy, and it can be quickly in Canada and spread very fast. So it's not just.
But just to put this in perspective, though,
Sure.
to put it in perspective, we've all learned now about the Spanish plague 100 years ago, where 50 to 100 million people were killed. We're clearly not there. But is there anything else that you teach that this most clearly or most closely resembles?
No, I don't think so. But of course, the whole idea of what every jurisdiction is trying to do is to prevent it becoming something of the enormity of Spanish flu. And given the virulency, as I understand it, of COVID-19, there is the potential for many millions of people to die around the world. We don't want that to happen. So we do have the capacity and ability to take various measures. And I think, at the heart of the course that I teach is this discussion of how do we balance what we perceive to be in the public good, what we think will achieve a public health outcome, with civil liberties and individual freedoms. And the tough thing is that we may not always know at the beginning of a pandemic or even as it unfolds what exactly is the right thing to do. And if a government is too aggressive and hindsight suggests that they took too many measures and infringed upon civil liberties to a greater degree, then they're in trouble. And if they don't go far enough and the contagion spreads because they weren't aggressive enough, and then of course they're in trouble again. So it's a pretty difficult place to be in, particularly as the evidence is changing, it seems, almost day by day, about what exactly is the right thing to do.
Right. In which case, Ryan, let me get you into the conversation here and ask you from a civil liberties perspective, how different is life today for the average citizen in the province of Ontario because of the emergency measures that have been introduced by public health officials and our various levels of government?
Our constitutional rights are always subject to limitation. That's integral to the Charter. So the restrictions themselves do not constitute threats to liberty. What constitutes a clear threat to liberty is being governed by a secret law, or the police enforcing what are guidelines rather than laws. And what I think people need right now, what the citizens of Ontario need, is clarity. They need to know that when this comes into an order in council, issued under the provisions of the Emergency Management and Civil Protection Act, that is the law that governs their conduct. And they can rely upon the police to only enforce that rather than some sort of recommendation. Because right now, what's prohibiting public buy-in, what's preventing the public from really saying, yes, we believe in this, we want to comply with these restrictions, is they're not being convinced, but they're being told. And what they're being told is often inconsistent. So what we need is clear instructions about what the law is with respect to social isolation or physical distancing. And I would argue that, in fact, those buzzwords or jargon are unhelpful. We need to have clear, plain language communication of what the law requires, understandable by someone, for instance, who's 21 years old and has a grade 10 education. And I think that we've been doing a really bad job with respect to that. And I think from a civil liberties perspective, if we think that coercive measures are going to work here, you're sadly mistaken, because they rely in the final analysis upon incarceration. And jailing people for violating these orders is completely counterproductive to controlling the spread of coronavirus.
Well, let me just follow up on one thing you said there. I mean, what could be more plain spoken than don't leave your house unless you absolutely have to go shopping or go fill a prescription, get some medicine. And if you go outside, practice physical distancing, be 6 feet apart from the next closest person. Is that not clear enough?
That would be clear, but it's not the law. So are we talking about what the law should be or what the law is? Because right now, under these emergency orders, what we have is a requirement that says there are no public gatherings of more than 5. So public gatherings must be 5 or fewer. That's what we have under the emergency order. And if the Premier believes that it is necessary and he receives advice that further restrictions are necessary, those need to go into orders in council. Those orders in council need to be publicized, and then those orders in council need to be communicated to the public in the straightforward manner that you just described.
In which case, Michael, what would you say to people who are concerned at the moment that their civil rights are being too much infringed upon by governments who are making these admonitions about our personal conduct and how we ought to behave these days?
So I guess first of all, I would say to those people, I understand, because I agree with Ryan that the suggestions and now the instructions by government officials have not been clear. I don't even know what social distancing means, and I do this for a living, being an ICU doctor. So we need to be clear, we need to be consistent so that the average person can understand what the expectations are. For those people who think their rights are being infringed upon, I'll just give you some context into the things that I'm thinking about 2 weeks ago. 2 weeks ago in Ontario, we were thinking about what are we going to do when we run out of ventilators, when we run out of doctors, when we run out of beds, when we run out of nurses. That's what we were thinking about 2 weeks ago. 2 weeks from now, we may be in that situation. So my perspective, focusing exclusively on the health of Ontarians, we need to set those things aside for now and focus on the greater good, which is making sure as few people as possible die.
Now that's some pretty stark language. Have our politicians been speaking that plainly lately, do you believe?
I can only say what I've been speaking to, and I speak very clearly and definitively. I think that we've been chasing this the whole time. We need to get ahead of it. This biologic problem does not pivot with news cycles. It's always out there, it's always growing, it's in our community, and it's spreading. And we will get to the point where decisions need to be made that seem obvious at the time, but 2 weeks ago they may have seemed draconian. But we need to make decisions in anticipation of what's going to happen. And I think this is the time to overreact. I don't think any politician is going to get it on the nose a year from now if they did everything they could to keep everybody safe. If they overcalled it, you can blame me. But we need to be proactive.
Well, Colleen, that does raise some questions about what has taken place halfway around the world, and I'd like to bring you in on that right now because, you know, I'll leave China out of the equation for the moment, but places like South Korea, for example, or Taiwan have apparently had a great deal more success than many Western democracies in getting a handle on this thing, and they've done it with something called contact tracing. What is that, and how has it been able to have been helpful?
Well, as I understand it, they more quickly actually closed their borders to people coming from China and Wuhan, and then in the light of that, we're able to roll out a massive amounts of testing, so some 10,000 a day, as I understand it, in South Korea. And then on the basis of that and tracking cell phone data, figure out if people had tested positive for COVID-19, where in fact they had been in recent, in the last 2 weeks, so whether they'd been in a particular grocery store or a park or where they had been, and then correlating that with other folks' cell phone data to alert them, the people that had been in the vicinity of the now infected person, about the need to go and test. And so they would send them a message in a secure platform, you need to go and test, lives are at risk, etc. So that is, it seems to have helped, as I say, flatten the curve. And that is a possibility here as well. It is possible, I think, as was mentioned, as Ryan mentioned, rights, privacy rights, for example, are not absolute. Everything needs to be balanced. And if there is, a clear view from public health officials that this is the kind of thing that needs to happen in Canada to protect this or prevent the spread of COVID-19, then it would be possible to do. But it is a complicated business, I think, because sometimes what seems, obvious perhaps to public health folks initially, when you think it through, may have adverse consequences. So, for example, people might avoid being tested in the first place because of the impact on their civil liberties down the road. So if they know that their private lives are going to be turned upside down, or that they may be incarcerated under fairly draconian measures, they might avoid testing in the first place. So, one can't just, I guess, pass a law or an edict and expect, everyone to jump and obey, perhaps as our public health folks might like, or our medical folks like that might like. You have to look at the evidence about what works and doesn't work from a public health perspective.
Well, it seems to be working in Asia. So, Michael, let me ask you whether or not you think this is something we ought to be doing here.
We should be testing everybody that we can, assuming we have the raw materials to do it. We need a turnaround time on testing that's immediate. And once we've identified people with COVID-19, we need to isolate them from society and aggressively contact trace them, like Colleen described in South Korea. Without testing and without an adequate public health infrastructure to follow up on patients and their contacts, we're not going to be able to slow down the spread of this. And while I understand that people might be marginalized if they test positive, I think because this is such an infectious disease, if you had it, I think you'd want to know so that you can protect your family from it, assuming that you're isolating with them. So I think testing is actually the key to all this. That's a separate topic. But
Yeah.
South Korea has been successful because they tested so many people. They have different geography than we do, and they were able to contact trace effectively, and they have flattened the curve better than anyone else. Italy is very different. And Italy is the situation that we're trying to avoid. New York is the situation we're trying to avoid. But those situations are foreseeable in this country without some significant changes in our behavior.
Okay, but Ryan, we just heard Colleen posit the notion that it's all well and good to get tested, and it would obviously be as helpful as possible for as many people as possible to get tested. But she did introduce this notion of somewhere down the road there could be issues around those who test positive, and those could be problematic from a civil rights point of view. What concerns do you have around that?
Well, with respect to contact tracing, if we amend federal privacy legislation to make that possible, I think there will be more buy-in if people were convinced that this was a temporary measure to address this particular crisis. So civil libertarians would likely support these measures if they had sunset clauses. And if there were guarantees that this wouldn't morph for use for some other purpose. So the cautionary example, of course, is the Patriot Act in the United States, the mass surveillance that came in under those measures right after 9/11. They were being used for every purpose in the sun after that. Now, given that coercion is not going to work very effectively in this crisis, as people know that we can't put them in jail, or that it would be counterproductive to do so, how do we get that buy-in? It's by saying it's for this purpose and this purpose only. We're very careful about how we amend the legislation in Parliament, and then that there's a clear sunset clause on it that says, and when this expires, it's done with no possibility of renewal.
Would you say it's a lot more difficult being a democracy at a time like this than being a totalitarian state, for example, like China, where to get a handle on things, they send in the army, they quarantine people off, they take away everybody's civil rights, but if their numbers are to be believed, they've flattened the curve in a relatively short space of time. What's your view on that?
I don't think so, and I think time is going to demonstrate the falsity of that notion. So in China right now, people are responding to coercion because it's rather extreme, but then after the fact, can they be trusted to comply when the government doesn't have that capacity? So if a situation emerged in China where there were suddenly not enough police because of the way the virus was affecting the population, or the army was infected and could no longer operate reliably, would you have the kind of goodwill that comes from people convinced, because of the democratic process, that what's being done is rational, justifiable, and in fact the correct decision because it was made publicly and with the correct input from stakeholders? I think that that's what makes democracies more robust. And then if you take a look at examples from history like the Blitz, you see that totalitarian countries didn't have that capacity that comes from people who have clear faith in their democratic order and their constitutional order.
Interesting. Michael, tell us this. There's been a great deal of debate lately about whether or not people, if and when they have to go outside, ought to wear masks. Could I get you to weigh in on that and give us your advice?
I follow the guidelines of the World Health Organization, and as I understand, based on today, right now, you only need to wear a mask if you're sick. And that's the advice that I would follow for myself, unless, of course, I was in the hospital where I wear a mask to protect patients from me, because I could pass COVID-19 to them even if I'm asymptomatic. So I don't think there's any utility in wearing masks as a general concept for people who aren't sick. And the risk of using masks is that we have a crisis with PPE supplies right now. That's personal protective equipment. And every person who buys a mask, that's one more mask that we won't have in the hospital to be able to treat patients. So I think we have to be very careful with the messaging and also follow the best scientific evidence.
What if you did your own makeshift thing where, and we're seeing this all over the internet now, where people take T-shirts or cotton cloth and they just wrap their face around it? Any point in doing that?
I think the risk is that sometimes people can use wearing a mask as an excuse not to comply with physical distancing measures or recommendations that you only leave your house unless you're doing your essential shopping. Plus, when people wear a mask and they're not used to wearing a mask, what you see and what I see lots of times on television is people constantly touch their face in the mask to readjust it. And that's how you get COVID-19. You take the droplets that are on your hands and you put them in your eye or in your nose. And so I think that it could actually subject people to risk unknowingly to them.
Gotcha. Ryan, can I go to you on this? We have seen all levels of government, federal, provincial, and municipal, roll out over the last week or so, or a couple of weeks, various powers that they all have to enforce behaviors that they believe will flatten the curve and get us to the end of this thing sooner than later. Can you compare, I guess, the different kinds of powers that the various levels of government have as it relates to, for example, sheltering in place orders? What can you tell us about that?
So primarily, the powers to do that are vested in the provincial governments as a function of the division of powers under the Constitution, what we used to call the BNA Act. So with respect to powers in public health emergencies, even if we declared a public welfare emergency under the Emergencies Act, and I'd like to return to that later, the powers of the federal government would be narrower than those of the provincial government, because under the Emergency Management and Civil Protection Act in Ontario, there's what you call a basket clause or residual clause that allows the Premier to do what is effectively necessary, whereas the powers of the federal cabinet under the Emergencies Act are limited to what is enumerated in that section of the Emergencies Act. And specifically, it says that we can't just assume power over what the province does. That's in Section 8, Sub 3 of the Emergencies Act. So when we're looking at what the provincial governments are doing and why it's more restrictive, it's because they have more power. The federal government primarily has power at the moment over people who have crossed the federal border under the Quarantine Act.
Okay, and we will come back to the Emergency Act later because I do want to get into some of that. Let me read a couple of things out, and then Colleen, I'll get you to weigh in on these first. Rona Ambrose used to be the interim national leader of the Conservative Party, and she had this to say to Prime Minister Justin Trudeau about 12 days ago on Twitter. She said, "Prime Minister, Canadians are ready for you to lead us further through this crisis. It's time to declare a state of emergency in Canada and tell us to shelter in place except for essential workers. We are ready to do our part to save others. We will not view it as an assault on our civil liberties. We will see it as an assault on COVID-19. We need one message for all of Canada." And then let me just add one other comment. This came from Goldie Hyder, who's the president of the Business Council of Canada, who wrote to the Prime Minister on behalf of businesses across the country, asking for both federal and provincial governments to, quote, act aggressively to keep Canadians inside their homes. And he said, beginning immediately, all Canadians should be told, not asked or advised, but told to stay home unless their jobs are essential or they must leave the home to purchase food or other necessities. Okay, two different approaches there from apparently the approach being followed right now. Colleen, what's your view on that?
Well, the first question is around whether the federal government can and should trigger the Emergencies Act. And I think the issue is, I think most people would agree that we are in a state of emergency. Every province has declared it as such. But as Ryan was mentioning, the ability of the federal government to trigger the Emergencies Act is actually quite limited, in that it must be, they must view that what's happening in a particular province to really be a risk to other provinces or the whole of Canada. So to be of the belief that a particular health measures being taken in one province are inadequate, such that it's a risk to others. So that is not that straightforward then to be able to say, well, there is an emergency from coast to coast, and we want to have, one rule for all, one ring to rule them all, kind of thing, under the Emergencies Act. Now, it may be that in the light of COVID-19, when we do a post-mortem of this, we may feel that our Emergencies Act at the federal level isn't actually fit for purpose, because if it can't be triggered in these circumstances, one would wonder when it could ever be triggered, and it has never actually been used. And as
let me get Ryan on that. Forgive me, we're down to our last few minutes here, so let me get Ryan to weigh in here on what powers the Emergency Act provides for the federal government that they are currently not using.
Very little, because what we have to remember is the Emergencies Act doesn't give more power to Parliament. The Emergencies Act is a replacement for the War Measures Act. So what the War Measures Act allowed government to do was to assume power from Parliament. It allows the federal cabinet to issue orders that have the force of law with very limited parliamentary oversight. And that's when decision-making gets bad. And you can say that it's because of that lack of oversight that we had such terrible decisions, as a decision to bring in the military into Quebec in 1970, which was completely ineffective. The terrorists who kidnapped and murdered those two officials were caught by ordinary police work. They were not caught by the army. And likewise, the internment of Japanese Canadians, which went on for 7 years between 1942 and 1949, was a result of the War Measures Act. Had that been debated in Parliament, we would have said that's a terrible decision, because the Canadian Army would have said, as they said at that time, that does nothing to promote the safety of Canadians. So when we're talking about the Emergencies Act, We're not talking about expanding the powers of the federal government relative to the provinces. We're talking about shifting decision-making authority from Parliament to the Cabinet, and that is particularly dangerous. I really wish that most Canadians understood that it doesn't give more power to the federal authorities. It merely transfers the decision-making authority from the Parliament to the Cabinet, with less oversight from Parliament and potentially less oversight from the courts.
In which case, Michael, from a containment point of view, does it matter to you whether the federal government brings in this act?
The legal framework obviously is not my area of expertise. I actually don't care. I think we need the most significant, aggressive, proactive measures possible in anyone's recollection to get ahead of this. Without that, people will die. Thousands more people will die unless we are mandated to stay away from each other. It's very simple. I don't care who does it. It just needs to be done. It needs to be done 2 weeks ago, like Rona Ambrose said, and like the other business leader said, not 2 weeks from now when we're out of beds.
I have seen you give this message numerous times on television over the last couple of weeks, and I wonder whether you think our decision makers are getting it.
I don't sit at the highest tables, but I have lots of other things I could be doing than being on TV right now, but I've chosen to do this because I need to do what I can to try and make a difference. And if one person changes their behavior because they've heard what I've had to say, that's good. There's a disconnect between what frontline physicians and nurses are seeing and feeling and what public health is advising governments. That needs to change. They need to listen to me. They need to listen to us because we are the ones who are going to be seeing people who are dying.
And I just want to be clear, though, at the moment, do you think they are adequately taking your warnings to heart?
No.
Why not?
Because there's still not enough being done. And when I walk around my neighborhood, there are still homes being built. There's still construction sites that are filled with people. There's still non-essential activities that are occurring. There's still people who, for whatever reason, aren't taking this seriously. And there's nothing more serious than what's going on right now. I'm the sharp end of the stick. I'm the person who's going to have to deny life support to someone because I've run out of machines, or take someone off life support because someone else needs the machine. And I don't want to be in a position where society has to deal with that situation, both personally, but also I think that's just bad for everybody. So we need to do everything now to mitigate the risk of being in that position in the future.
I think that very stark advice is a good place to leave this. So I want to thank Colleen Flood, Ryan Alford, and Michael Warner for coming on to TVO tonight and having this conversation. Many thanks, you three.
Thank you.
Thank you, Steve.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.